Hello, everybody. My name is Bob Brocker. I'm the founder and president of this organization called Age-Wise Colorado. Today, we're going to be talking about Alzheimer's and other forms of dementia care. I'm going to introduce both speakers here at the same time, and then I'll turn it over to Kay. Kay is an author, speaker, coach, and educator, founder of Compassion Works LLC, which provides dementia coaching and educational programs to family and professional care partners across the country. Kay is also a certified dementia consultant and trainer with a passion for supporting people with dementia as well as the families and communities entrusted with their care. And I know Kay has a book, and you can mention your book whenever you want, Kay. Derek Williams is the owner of Comfort Care, which is an in-home care provider in Northeast Denver. His proprietary program called Dementia Wise engages and enhances the lives of people with Alzheimer's disease and other forms of dementia while providing support and education for the family. Caregivers take special care to recognize behavioral triggers and use redirection, which may help prevent or reduce any challenging dementia behaviors while helping clients remain independent for as long as possible.
Thank you all for having me here. I'm excited to be with you all today. So I'm going to talk just a little bit today about the practical aspects of dementia, how it affects our brain's abilities and influences our behavior. Because what I find as a dementia coach and educator is if I were to go down to the 16th Street Mall and survey people for 4 hours that were walking by, and if I said, what do you think dementia is? Most everybody's going to say they're going to say it's Alzheimer's, or they're going to tell me it's a memory problem. Most people are not going to say it's a terminal illness. Most people are not going to say it's something that affects every part of a person's being, perhaps, right? They're just going to be focused on the memory part, and it's way more than that. So I just really find this is a term that people are very confused by. Like when I say, what is dementia? Because it's many things, but just to simplify things for today, dementia is a chronic or a persistent disorder that's caused by one of two things. It's either caused by a disease inside the brain, like Alzheimer's disease, or it's caused by an injury to the brain, like a TBI. Like you've had a car accident, crashed your head into the windshield, or you've had too many concussions in sports injuries or domestic violence or falls. So one of the, I think, myths that are going on right now is that people think dementia is so common that they think it's part of normal aging, but it actually isn't. It's caused by a disease in the brain or an injury to the brain. And for those of you who know who Teepa Snow is, I was trained extensively under Teepa, worked as a contract employee for her. And she came up with this umbrella of dementia graphic to try to simplify having people understand what dementia is. I had been quoting that there was like 120 different kinds of dementias, but I was at a workshop 3 weeks ago where a neurologist told everybody there was like 300 kinds of dementias. So, oh my gosh, I don't know what those are. But here are the most common forms of dementia under the umbrella. So, Alzheimer's disease, we'll talk about that, is the most common form of dementia we hear about. Vascular dementia is another form that's caused usually by strokes. So a lot of people have dementia as a result of a stroke. Lewy body dementia is a different type of dementia that's very common, that comes with a lot of hallucinations, changes in mental status. Frontotemporal dementia is a different kind that affects mostly the frontal lobes and temporal lobes of the brain. There's other kinds of dementias like mixed dementias. So it could be like Alzheimer's disease and a history of alcohol abuse, or a history of a stroke or something like that. Or it could be an alcohol-induced dementia, other things. So the thing that I find interesting is that most people talk about dementia as either or. When I used to work in the diagnostic memory clinic here in Denver for Kaiser, people would say, oh, my mom got diagnosed with Alzheimer's, but thank God she doesn't have dementia. Or vice versa. My dad got diagnosed with dementia, but thank God he doesn't have, vascular dementia or something like that. So they say either or. But when we do things like talk about cancer, for whatever reason, our brains don't do that. We can say someone has cancer and understand that it could be in their pancreas, stomach, breast, brain, liver, wherever. But we all understand implicitly that it's all in the same family, right? It's all in the same cancer family under that umbrella. But for whatever reason, we don't tend to do that when it comes back to dementia. So if nothing else out of this little bit of my talk today, if you can figure that out, like they're all in the same family. It's like walking into an ice cream store, all ice cream in the place, but they're all different flavors, right? And so there's different flavors of dementia that are all under this umbrella. But the one we hear about most often is certainly Alzheimer's disease, and there's good reason for that. It's a degenerative brain disease, meaning it gets worse over time. And it's the most common form of dementia of all the 300 different kinds of dementias out there. It's again this year the 7th leading cause of death for people that are 65 and older. And most people know that it causes memory problems, but it does way more than that. It causes problems with language, problem solving, and other cognitive skills that eventually impact a person's ability to perform day-to-day activities or to remain independent. And this is because nerve cells or neurons in parts of the brain involved in our cognitive function have been damaged or destroyed. And that ends up in what we call brain failure. So with Alzheimer's disease right now, with just this one form of dementia under 300 kinds under the umbrella, Alzheimer's disease, 1 of every 3 people die from Alzheimer's disease or a related dementia, vascular, Lewy body, mixed dementia, those things. 1 of every 3 seniors. It kills more than breast cancer and prostate cancer combined. And by 2031, which is coming right up, we're going to need 1 million additional healthcare workers just to work with people impacted by dementia. And they're not coming from our country. We need to be creative about how we're going to meet this demand. And the thing that's really hard for me and what keeps me going in my business is that nearly 20% of spousal caregivers die before their loved ones with dementia because of the caregiver burden, and 40% report increased depression and stress. And part of that is because this is an illness that goes on for a very long time for a lot of people. The average time from diagnosis to death is somewhere in the range of 7 to 11 years. Some people live a year or 2 years, some people live 20. So that's a long time to be a caregiver, and it's a lot of responsibility for folks. So again, I talked about it ends up in brain failure, which is very different than saying they just have a memory problem. So I cut to the chase with people because I've realized after 25 years in this work that if people are only ready for a memory problem with their loved one, they are not ready. And I've learned that it doesn't do us any good to sugarcoat this or tap dance around this subject, because the better prepared you are as a care partner or as yourself going through this illness, the better your experience is going to be, in my opinion. So people, even in an early stage of a dementia, even right out of the starting gate, 50% of people have no idea that something's different in their brain. They have no insight, they have no awareness at all. And this is different than denial, which I'll talk about in a second. But the people that do have insight and awareness, they tend to get anxious, they tend to get angry, agitated, overwhelmed. I often hear people say to me, it feels like someone has hijacked my brain, or I feel like I'm going crazy. I keep losing my wallet or my purse or my car keys. I can't find my car in the parking lot. What's going on? I know something's wrong, but I don't know what it is. So, but other times, 50% of the people have no idea anything's different. And that's called anosognosia. It's a Greek word that means the inability to recognize or acknowledge their cognitive impairment. And I like to point this out to people is if I'm in, because I hear families tell me all the time, my dad, my mom, my brother, my partner, they're in denial about their dementia. I would be a very wealthy woman if I had a nickel for every time I hear that said to me. They're in denial. Okay, so I'll use a quick example. If I felt a lump in my breast and I went into the doctor and I had a workup and they say, oh, we're concerned about this, we want to do a biopsy. And then they come back to me and say, you know what, I think it's cancerous. We need to get a, surgery scheduled for you, radiation, chemotherapy, all of that. You have breast cancer. And I come home from that appointment and I stick all the paperwork from the doctor in a drawer, and I don't tell my friends and I don't tell my family, and I push that to the back of my brain. That is denial. Okay. You have to acknowledge something on some level to deny it. But anosognosia is different. Anosognosia is like they can't see it no matter what you do. It's almost like addiction, where the person is like, I'm fine, I could quit drinking anytime I want, and everybody around them knows that's not the case, but they can't see that in themselves. So this is what causes a ton of friction and tension and really makes dementia a complicated illness, is because families are trying to keep their loved ones safe, and the person with dementia has no idea anything's wrong with them, and they don't want anybody meddling with their life. And so we have a lot of tension because of that. So dementia can change everything because our brains control everything. Depending on what part of the brain gets impacted and how seriously it's impacted, it can really change people's lives profoundly. And it's not something that a person can control, but it can seem confusing because some days they can do things, they can unload the dishwasher, they can pay their bills okay, and other days they can't take the first step in that process because it fluctuates a lot. So it's confusing. And it's not the same for every person. And so what I find a lot as a dementia coach and educator is that somebody will say, "Oh, my grandmother had Alzheimer's disease, and now my sister has Alzheimer's, and so it's going to look just the same." And it doesn't. It's an individual path for each person. So if you know one person living with dementia, you know one person living with dementia. You can't project what it's going to look like for them. And it's not a mental illness, but we still have a whole bunch of stigma around it. But I'm trying my best in my little corner of the universe to break that stigma. But what is for sure is it's real and it's very hard at times. So let's kind of dive into how does dementia affect our brain abilities and influence our behavior. So here is a PET scan. This is a PET scan of 3 different brains. So the normal brain has 2 different angles that the camera was at. The early Alzheimer's, 2 different angles, late Alzheimer's, 2 angles, and a child's brain. So what the colors represent in this are how efficiently a brain is burning fuel, okay, glucose. So you'll see in those 2 different images of the normal brain, there's lots of red, right? So that's like a brain that's operating at a high level, burning fuel really efficiently. When we get to this 2 shots of the person with the Alzheimer's brain, you'll see kind of there's more like of a green color or blue in there, not as much red. So that's more like a mid-level burn. People aren't functioning as high as they were cognitively. And then, wow, look at the picture of the late Alzheimer's brain. Do you see all the purple there? The purple represents brain cells that are no longer operational, that have been impacted by the disease or by an injury and are no longer functioning at all. They aren't working at all. That's a lot of brain mass right there. And then you see the 2 different images of a child's brain in this PET scan. And the reason that's included is because if someone lives to the very, very, very end stages of a disease like Alzheimer's, which could, like I said, take up to 20 years, depending on the person, they lose enough brain mass from that atrophy, when the brain atrophies and dies, that their brain could end up the size of a child by the end of the illness. So the whole time we've built all these skills from childhood on, we lose over time. And that's why the burden of care is so high in this disease, because if people live to the end of it, they can't walk, they can't talk, they can't dress themselves, they can't feed themselves. They're incontinent of bowel and bladder. They are total care, and we have to anticipate their needs 24/7 for sometimes years on end, right? So it's not just a memory problem. So here's a picture of 2 different brains from the same age of men, 2 different men. One died in a car accident with a normal brain, one died of Alzheimer's. And what might really jump out to you right away looking at those 2 images is you can really see the atrophy or the shrinkage of the Alzheimer's brain, how much smaller it is than the normal brain, how diseased it looks. And it almost looks like the Grand Canyon in there, right? It's missing a lot of real estate. So you can really see how much brain mass has been lost in that image. And there's a book I refer people to a lot, written by Greg O'Brien, who's a journalist who's been living with early stage Alzheimer's disease for years and years now. And he wrote a book called On Pluto. And this is a quote from the book. It says, "It's been said that Alzheimer's is like having a thin sliver of your brain shaved off every day. It's been said that in 25 years, there'll be 2 kinds of people in the world, those with Alzheimer's and those caring for someone with the disease." And with the stats being what they are, I think that's pretty true. So again, here's another shot of the brain atrophy that you can really see how much smaller the Alzheimer's brain is. And it depends on what part of the brain the disease hits and how much shrinkage there is. And depending on what part of the brain it hits, abilities are lost, corresponding abilities, which we'll talk about. So of all the different kind of dementias out there, we know the most about Alzheimer's disease, but again, each person goes through it differently. So this is my play along part. Whether your camera's on or not, everybody finds your right hand and put it right back here at the back of your head. Okay, right back here. So if you didn't know this before, this is your occipital lobe. Okay, that's your occipital lobe. So that's what you're seeing circled right here in this picture. Until I went through intensive training with Teepa Snow, I had no idea that dementia affected the vision so much of people. But if you see here, then the normal occipital lobe versus the occipital lobe with dementia, look how much is missing again. There's just huge gaps, a lot of atrophy and shrinking. So it's major. So I'd like you to play along with me again. So if people are in an early stage dementia, it's like wearing a scuba mask. So I can see a lot of you on here. I can see if you're doing it. So act like you're putting on a scuba mask, okay? So that's wide, not binoculars, wide, okay? So if you move your head around with a scuba mask, what you'll probably notice is the thing you have the hardest time seeing is your peripheral vision, right? The peripheral vision. And sometimes it might be your depth perception. So you have to move your head around to see those things, okay? So that is early stage dementia, which even in the early stages is why we worry about driving safety, right? Because you might not see that car swerving into your lane. You might not see the kid chasing the ball in front of the car, or the person who's putting on their makeup in rush hour traffic, driving with their knee coming into your lane, right? Because that peripheral vision changes. Okay, so now put on your binoculars, you guys. Put on your binoculars and now look around. And what you might notice, especially if you were walking, is that you would not see the stairs below you. You would not see the curb coming. You would not see the throw rug. You would not notice if you had spilled oatmeal down your shirt. Okay? This is mid-stage dementia. This is the longest stage. This could last 7-10 years, which is why we see a lot of accidents with driving, which is why we see a lot of falls that happen with this disease, is because how impacted the vision is here. And then if people live to the very end, if you close one eye, cover one eye, and then do like this, monocular vision is in the very end stages, this is all the visual field people have, very, very small. But we still interact with them as if they can see everything when they can't. So we will startle people a lot. We will bring on behaviors based on our own ignorance or lack of education about what this disease can do to someone's brain. So again, there's losses in the peripheral vision, there's losses in depth perception, and then in object recognition. So here's my phone. What happens a lot is people start trying to use their phone as a remote control for the TV, or the remote control for the TV as their phone. Or maybe, let me see, maybe I have this highlighter here and I'm trying to eat my soup with it, okay? And then family members will say to me, why is my mom doing this crazy stuff, you know? Well, it's because this object, because of the occipital lobe changes, somebody doesn't recognize this as a highlighter. This is to highlight, you know, lines in a book. They don't understand what it's used for or what it is because of these visual changes. So people will do a lot of funky things with stuff because they don't know anymore. And then people are slower to process information. And what they see, though, is still things in the middle of the field, right? And that curiosity remains right there. There's also really big changes in the hippocampus part of the brain. And this we know for sure is one of the first places that Alzheimer's disease in particular hits. And when people tell me that are early stages of a dementia, and they say, Kay, I feel like my brain is a sieve. I feel like everything's just falling through. I can't hold on to new information. Look at the holes. There's literally holes in the hippocampus here. And so people can't hold on to information. And the hippocampus does three main things. It's our wayfinding system. It's our internal GPS. How do I get to King Soopers and back? How do I get to church and back? How do I get to the bathroom in my own house and back? Right? And that's why one of the key questions to ask people in screening is, have you gotten lost in familiar places? Because people could be a block from their home of 40 years and not recognize anything because of changes in the hippocampus. The hippocampus is also our learning and memory center. It's our ability to form new short-term memories. This is why people with Alzheimer's and different kinds of dementias ask the same questions over and over, tell you the same stories over and over, and drive, you know, family members crazy because they literally, it's like Velcro that doesn't stick. They cannot hold on to the information. It is falling through. And the last thing that the hippocampus does that's really important is time awareness. Is it morning, noon, or night? Is it 2025? Is it 1925? You know, is Is it winter, spring, summer, fall? This is why people get very confused about all of that stuff because of changes in the hippocampus. So the hippocampus, you know, interferes with people's ability to remember things that just happened, to make sense of recent events and relationships. So if someone is 90, but in their brain they've time traveled back and they think they're 20, and this guy next to them says, I'm your husband, and they're like, no way, you're not I don't recognize, you can't be my husband because I'm 20, right? And so that's when they don't recognize their kids or their spouse or their best friend of 50 years because of changes here in the hippocampus. But what they can hold on to oftentimes is long ago memories that happened, decades ago. And so families will erroneously think, oh, my family member doesn't have dementia because they can remember everything about their Army days or raising us 5 kids or whatever it is. But that's a different bucket, okay? That's not the hippocampus. Also, people can confabulate. They can take something that's somewhat grain of truth and then spin it into a story. Their brain can spin it into a story that isn't true, but to them it's true. So that gets very confusing too for families because it'll be like, well, they're telling people that, they've been traveling the world on cruises and my mom's never even been on a boat in a lake. What's happening? Well, mom might be watching The Love Boat and had access to a Viking magazine, and suddenly her brain thinks she was on that ship, right? And so they get mixed up between what is reality and what isn't. And emotional memories remain, as do motor memories a lot. And those are preserved, and we can work with those, which is things I work with families around. And then there's also big changes in the temporal lobes. So we have temporal lobes on the left side and on the right, okay? We have 2 of them. And you can see again in this slide how much damage was done to the temporal lobe here. So I'm going to tell you guys, this is kind of, you can do this in your head. Even in the early stage of a dementia, people can miss at least 1 of every 4 words we say to them, okay? They're just not grasping it. So I'm going to give you a few sentences. I'm going to leave out every 4th word, and I'm going to see if you have any idea what I'm saying, okay? So here's the sentence. Unless someone cares a whole awful, nothing's going to get it's not. Unless someone cares a whole awful, nothing's going to get it's not. So it's from Dr. Seuss and the Lorax. Unless someone like you cares a whole awful lot, nothing's going to get better. It's not. This is early stage, at least 1 every 4 words that we say, which is why language becomes very compromised for people. So for most of us, our language centers live on the left side of our brain, all right? And so what those do is that helps us develop vocabulary. It helps us with comprehension, reading comprehension, verbal comprehension, right, of language. Also there is our speech production. This is why people start having word finding problems, can't think of the word, talk around things because of the changes that happen over here, because we lose on the left side. The temporal lobe gets affected way differently. But what's retained on the right side till late in the disease of dementia is often rhythm, music, poetry, and prayer. So if you've ever seen the Alive Inside documentary where people could have such advanced dementia that they can't say their name or speak a sentence, but if you put on music that is from their especially teen years or early 20s, they may belt out every word of it because that's on the right side in the right temporal lobe where that's living. So we can work with those kinds of things. It's also social chit chat. So this becomes very confusing for out-of-state family members, right? I'm calling dad in the assisted living, checking in with him, but the sister, the daughter's the primary caregiver in town. And the brother calls in and talks to dad and then says to the sister, he sounds fine. I don't know why he's so bad. It's because they're just talking about the weather or the Broncos or whatever. But if you try to drill down below that, dad can't do it. And the primary caregiver knows that, but the out-of-town family member doesn't. And the other thing that's tough about this is that for most of us, what's retained until late in the disease is all the words we learned on the playground as a kid. The profanity, racial slurs, sex talk, ugly words that we all know in different forms, right? We all know them. Whether we choose to use them or not is the question, okay? And so for most of us, we don't store these special words over here on the left side where we lose it. We store it over here on the right. So people in late stages of dementia that might be in pain and want to say, I'm hurting, can you help me? Or I'm cold, can you get me a blanket? Or I'm hungry, could you get me some food? Or I'm confused and I don't know what to do and I'm lost, right? Because they can't articulate that because of the language changes on the left. What they can say is goddamn son of a bitch, right? That's what they can still say. Or racial slurs or fill in the blank. And so I can't tell you how many times when I worked in Kaiser and I worked with geriatric psychiatrists that facilities wanted psych meds given to dementia residents for that kind of behavior when it's nothing they could control. It's just that those were the remaining words they still had access to and not the ones over here. So another part of our brain is right here underneath our forehead is our frontal lobe. Very important. This is the last part of the brain to develop. Now I have a 15-year-old son who's just starting to drive, and this is why insurance rates are so high for teenagers, especially boys, because their frontal lobe doesn't really fully develop till somewhere between 21 and 25 years old. So they're like, hey, piling 10 kids in the car and driving down Colfax at 70 miles an hour sounds like a good idea, right? Because their emotion, judgment, behavior, reasoning isn't all intact yet. It's not fully formed. So it's the last part of the brain to develop, and it's a very important part of the brain. It helps us control our impulses, right? If if we want to cuss at somebody, if we want to swerve and hit the car in front of us because they've been a jerk to us, or hit somebody that's offended us, or whatever, if we have an intact frontal lobe, it helps us control our impulses, pull us back from all of that. Okay, it helps us with decision making, planning, processing, sequencing tasks, all those kinds of things. It helps with self-awareness. So this is again a big conflict in families because often families are sacrificing everything in the name of caregiving. But the person with dementia is like, why are you so crabby all the time? Why are you saying you're so tired? You don't do anything. And they don't realize they're doing the job of both of them, right? They're doing everything and then some. And they lose that ability to see that in another person and they lose empathy. And that's heartbreaking on relationships. And that all lives in the frontal lobe. So the other sensory changes to be aware of is pain. So people can't locate in an advanced dementia what's going on in their body. So there's lots of unwitnessed falls that happen with people with dementia that they can't tell you, they don't remember. And even if you witnessed the fall and saw them break their left arm and you literally saw it happen and you said to them, where are you hurting? They may point to their right shoulder. They can't tell you in their body where, because it's brain changes. And they certainly can't rate it on a 1 to 10 scale. So we have to have our own detective hats on and be alert for all of those kinds of things based on behavioral changes. Are they guarding something more? Are they more agitated? Are they crying? Are they acting differently? And try to piece the puzzle together. Because oftentimes people with dementia are over medicated for psych meds and under medicated for pain meds because they can't tell us that they're hurting. And it also affects self-care changes. So people often lose the ability to initiate tasks. They don't know how to start a task, or maybe they start it and they don't know how to stop themselves. They might lose the skill. So fine motor skills get affected. So people that were lifelong, maybe carpenters, can't do a hammer and a nail anymore, or seamstresses can't sew, can't sequence those tasks, can only do one thing at a time and may need help even doing that. But what is preserved often is motions and actions and the doing part. So if this was my spoon and I couldn't figure out how to use it, somebody could come hold my hand, like we call it hand under hand, and help me, cue me to get my soup up to my mouth and help me do that over and over. And guess what? Oftentimes that muscle memory kicks in, right? And then maybe I am able to feed myself a little bit. So these parts are maintained longer. So we just need to help people. And this is what I work with people a lot in the coaching arena. And then kind of here at the end is trying to understand why people living with dementia have behavioral issues or behavioral expressions that might happen and cause a lot of tension in the caregiving relationship. And one of those is just they're trying to solve a problem with a brain that's dying, right? They're just trying to get through life, and maybe they were a CPA, and now they're trying to add 5 plus 5 on a piece of paper, and they can't figure it out, and they know they can't figure it out, and they're pissed, right? So they're throwing the checkbook or they're throwing the thing across the room because they're so frustrated. They're just trying to solve a problem with a brain that's dying. Or they're trying to cope with a stressor. There's too many people in this room. I'm overstimulated, or I'm cold, or I'm hungry, or I'm in pain. And they don't know how to tell us. They can't communicate that to us. And so what do? They yell, get me out of here. I can't stand it. Like that, because they can't tell us directly what they need. Another reason could be because they're trying to gain control. So again, the anosognosia, they have no awareness or insight, right? And the family's trying to keep them safe, taking their car keys away, taking their credit cards away, done all these things to ensure safety for their loved one. And the loved one with dementia has no insight or awareness. Doesn't all they know is that suddenly their spouse is becoming their jailer, is how they feel, or their daughter is trying to be their boss, and they don't understand why. That it's actually out of love and compassion and care, but they just know someone's trying to rule their life and they don't like it, right? So there's a lot of this conflict. And the last thing, it could just be they're trying to communicate a need. I'm hungry, I'm tired, I'm lonely, I don't have a purpose, and I don't know how to tell you all those things, right? I need your help, but I don't know how to communicate that to you. So lastly, what I try to work with people broadly on is how to manage stress as a caregiver and build resilience. And a lot of the things I work with care partners around is adapting their internal expectations of the person living with dementia, that's PLWD. And it's often easier for us to do that than to adapt in our expectations of ourselves. So if we're doing the job of two people, we're managing everything in the household when we used to only manage half, but we still have this super high expectation that we're going to be infinitely patient, kind, compassionate 24/7. It doesn't work that way. So we have to cut ourselves a break with self-compassion, and I'm working with people with that all the time. I do a lot of these programs so that people can understand the symptoms and progression of the disease, because how can you be a good caregiver if you have no idea what you're even dealing with? And what breaks my heart is often what caregivers are seeing is actually symptoms of the disease, but they don't know it's a symptom. So they just think their family member's being a jerk, being lazy, being manipulative. It's usually a very negative label when they don't understand what they're actually witnessing is a symptom. And then I work a ton with people about taking care of yourself and setting limits. Easier said than done as a caregiver, but most of the families I work with in the 35 states and 2 countries right now are doing it alone, almost always doing it alone, and that is not sustainable. People are going to need help. So you got to take care of yourself along the way. Build communication skills is which I work with people around, and then recognizing what you can't and can't control. And we can't control the disease that doesn't have a cure, but we can control how much we learn and what skills we learn, and trying to control our own responses instead of being reactive, our responses. And there's a gap between those two that I try to work with people with so they can get better control of this. Bob mentioned earlier, I have a book that came out. It's called Bedside Witness, Stories of Hope, Healing, and Humanity. I'm very proud of it. It's an award-winning book, and it's 35 vignettes from 20 years of my career in hospice and palliative care, in the memory clinic and palliative care in Kaiser, and in my dementia coaching business. And my heroes in the world are care partners. And so I really try to shine a light in the lives and living rooms of people living with various diseases, including dementia, and just the inspiring lessons I've learned from them. So it's on Amazon and paperback, it's on Kindle, and it's on Audible. So I'd love you to check that out. A lot of education embedded in the book. And then I have a couple last scheduled Zoom workshops coming up. Colorado Respite Coalition has been sponsoring a lot of my programs. So I have one that's coming up this week. When will I know it's time? Moving a loved one to a care community and what to expect. And then I have another More Than Memory class. I do these every month. Understanding brain change and dementia from the inside out. A lot of what I've talked to you about today is from that workshop. That's a very powerful one to take. And then my last scheduled one through June is the symptoms and challenges of Lewy body dementia, helpful tools for care partners. So you can check that out. You can find out more about my workshops on my website at kmadams.com, or look me up on Eventbrite. And then if you ever want to be on my mailing list, please drop me an email and I'll add you to the list. Then you will be notified of upcoming free offerings I have, and you could share that with clients or whatever. I like to be as resourceful for as many people as I can in my work. So if you pop me an email and ask me to add you, I'll do that. And And then my email is k@kmadams.com. And my contact information is 303-875-5508. So thank you so much.
One of the options that's available to people is to bring in an outside home care agency to help their family member or themselves with living with dementia. And so I'm the owner of Comfort Care. Comfort Care has a proprietary training program for all of its office staff and caregivers called Dementia Wise. I'll go into that in a little bit of detail, but if you want to reach out, give me a call, or please feel free to email me. Um, my information is right there. What I'll talk about a little bit is just give an example. I believe it's hard to explain the breadth of things that home care can do and the type of care that we can provide. And an example is a good way to do that. Then I'll talk a little bit about Dementia-Wise, what home care is, some of the benefits, and then I'll leave you with some tools that we use that are trained through Dementia-Wise for caring for somebody with dementia. And then finally, there are ways that you can use technology to supplement in-person care, and it can help make things much more affordable. So I'll start with a case study. This woman was introduced to us a number of months ago. She was 88 at the time. I think her birthday is 89. She'll be 89 next week. And she's been living in independent living for many years, at least 5 years, on her own, and very proud of the fact that she could remain independent, but in independent living. Her family, her son and her daughter reached out to us at the beginning of the year because she was beginning to develop and progress really quickly through her Alzheimer's disease and the symptoms related to that. So they brought us in to give them a little bit of respite care, a few hours a week. And fast forward to last month, that turned into 24 hours, 7 days a week care, which is quite expensive. So during that time, they spent some time looking for memory care options for their mom, and they moved her in yesterday. So what we have been tasked with is helping her move into that community for the next couple of weeks, week or two, to help her get established. As Kay mentioned earlier, the emotional memory can take a little bit of time to establish familiarity with where you live, and it helps to have someone just help you out during the evenings in particular, while the community is able to do a lot of things during the day. So we've been brought in to do that. She is also starting to fall more often, largely because she's developing tunnel vision, and I'll talk a little bit about that. So we are also installing the fall detection devices so that when our caregivers finally do end up leaving her alone in the evenings, as the plan is, the fall monitors are going to be available to detect if she falls, and then they will call the front desk to come help her get back up. So you can see there's a large depth and breadth of expertise that's provided from home care agencies, and they can be utilized in many different ways. And I'll go into those here in a second. So Dementia-Wise is an occupation-based, team-centered training program that allows us to provide specialized dementia care. My agency is certified in Dementia-Wise, and that is recognized by the Alzheimer's Association. And then there was a study done at Duke University by a number of occupational therapists that validated the impact of the program as an effective training tool for caregivers. And essentially, in addition to the hours of training that are provided for staff and my staff and the family, it includes techniques that help manage the challenging behavior that Kay talked about during her part of the presentation. There's also ongoing skills and support groups, webinars, and then lots of resources available to families to help care for their family member with dementia. And then what exactly is home care? Home care is personalized one-on-one care services that are in the individual's either home or their primary residence. It can include or does include assistance with daily living. So many of those things include medication management, companionship, um, cleaning around the house, uh, and various other activities that become challenging as you get further and further along with your disease. And then we help with transitions of care. So I mentioned that we help, or we are helping move that woman from independent living into long-term memory care. So that is something that we can be tasked with and is effective in helping someone establish themselves in a new home. And the benefits are significant. Individuals are able to remain in familiar surroundings. We heard Kay talk about how important it is for familiarity and routine for people with dementia. The care is one-on-one, so many times in other settings it may be 1 to 5 or more. In home care setting, it's one-on-one. The care is personalized, so my manager of care services will come in, develop a personalized care plan, and then that can be modified as time goes on. And then the family remains involved, and there is some cost effectiveness there early on until someone needs to move into higher levels of care. We have a program called The Tipping Point, and we talk with the family about when that time is so that they know what they're going to do and when it's going to be that their family member needs to move into a higher level of care. But essentially, home care enhances their quality of life for the individual as well as their family members. It promotes dignity and then helps keep the people living with dementia safe and comfortable in their environment. So I'll leave this with you guys for now. For today is essentially what Dementia Wise trains people. And if you're interested in learning more, I'm more than happy to walk you through it. But essentially, there are 3 tools for effective dementia care. Check yourself, make a meaningful connection, and then use effective two-way communication. So checking yourself largely is centered around the fact that people living with dementia are going to mirror the feelings that you have in the moment. So if you're agitated and angry, they're not going to understand why, and so they may begin to get agitated and angry as well. So when you start your relationship with them and when you start your interaction with them, before that, you should check yourself, relax yourself, become present, and just be ready to deal with the unexpected. So that's what check yourself means. Use visual cues, be friendly. Kay had that wonderful demonstration of the tunnel vision. So what we do is we teach you to approach somebody from the front. If you come from the side or if you touch them anywhere else but their hands, you may startle them, and that will get them into a spiral that you're not going to be able to pull them out of for a while. So what you should do is approach them face to face, grab their hands in that hold that Kay mentioned with the underhand, and then once you have their attention and they're comfortable with you, then you can move to the side and handle them in a different way. The second tool is so much of the impact of Alzheimer's and dementia is related to factual information. The emotional aspects of your brain are untouched. So if you are able to make a connection with someone, make them feel comfortable make a very meaningful and social connection, as Kay mentioned earlier, the chit chat. That is something that they are able to maintain. If they get positive feelings flowing, you're going to have a much more successful outcome in whatever you're trying to get them to do. So be friendly, compliment them, swap jokes, and then get them telling a story. It is entirely possible and very likely they will tell you the same story over and over and over again. Just act like it's the first time you've heard that story, because that is the world that they live in. It is what it is. Enjoy it while you can. So the third tool for effective two-way communication is just lean on those um, things that Kay mentioned earlier, especially with what their strengths are and what they still retain. So social chit chat is something that they are very good at. Look interested, respond when they ask a question, laugh. Formal language isn't as rhythmic as chit chat, and then don't correct them. If they say that they are at the doctor's office, just say yes, and then redirect them to it's time to go use the bathroom or something like that. If you tell them no, or if you try to change what their reality is, they're going to become defensive and they're going to be more difficult to work with. So borrow the strategy from improv class and use yes, and as a way to interact with these people. And the last thing I want to mention is supplementing care with technology. So it can be very expensive for 24/7 care. We have a number of offerings from fall detection and remote monitoring that are quite good at helping supplement the cost of care. So you can go from many thousands of dollars a month for in-person care down to several $100s if it's appropriate for that individual. And then there's also virtual caregiving options if they're still able to use technology. But by and large, the fall detection and the remote monitoring do not require any interaction with the person living with dementia, and that is the best way to approach it. If you depend on them to click a button or do something, they're probably not going to remember that, and so it's probably not the appropriate option for them. So to summarize it all, home care, particularly with comfort care, we have trained caregivers in dementia-wise and dementia tactics to help family members as well as our caregivers care for these people. The care is individualized one-on-one, and it is updated constantly as their disease progresses. So the example I gave you is several months, a very accelerated timeline. But as Kay mentioned, you could end up living with dementia for 20 years. So it depends. And then with the supplement of technology, things can be more affordable than other options. Thank you for having me. And Bob, I'll return it back to you.
Well, I will say this. I wish I had known a lot of this information several years ago, you know, dealing with my dad. But you know, it is comforting though to see that there's more progress being made in educating caregivers and people who may, you know, may end up with dementia at some point. So that people can better deal with the situation as a caregiver. Um, and having seen even what my mother went through with the stress of dealing with my dad, I can very much appreciate what you were saying earlier about the caregiver, you know, needing that, knowing how to deal with this stuff that she had no idea. So it was it, and I think a lot of people are in that same situation even today.
Most
But
people, most
yeah.
people.
And what did you say the percentage of people are who will probably get dementia at some point? I've heard that percentage somewhere like 20% or something. Yeah.
Oh, I don't know if I quoted that. I just, it's the seventh leading cause of death, Alzheimer's, just itself. And one of every three people in our country die of some sort of dementia, age 65 or older. So,
Okay.
I mean, it was an epidemic before we had a pandemic.
Mhm.
And I don't know, Derek, but we didn't have enough staff then. We didn't have enough resources then. And now it's just going up and up, So we got to be creative with this. We really
Yeah.
do.
That's a huge importance of the technology. I got a call the other day from home health looking because the primary caregiver of someone with dementia died. And so what does that person do? And he's falling all over the place. So we're able to help with the technology and then um, get them started on providing some in-person care. But it's so important for the primary caregiver to get a break.
Hmm.
So and to take one, and then also learn how to manage that. Yeah.
Or they're at risk for dementia themselves.
Yep.
So,
Yep.
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 Well, thank you both for the work you're doing, and we very much appreciate it. Thanks for your time today, and thank you all for joining us. And we'll have this recording up on our website in a few days. And I encourage you to, to not only look at it yourselves, but to share it with other people that need to know this information. And I would say the same thing about the one that we did with Dr. Potter a couple weeks ago. He was talking a lot more about the drugs, the drug research around, being able to slow, stop, eventually, maybe even possibly reverse um, this disease. But we're still a long ways from that. So you can't count on that in the next 10 years, I don't believe. But who knows?
I hope somebody cracks the code at some point. But
Yes,
they've
it.
known about Alzheimer's since 1906, so it's not.
Mhm.
It's a long time coming.